Polycystic ovarian syndrome is a condition in which the female reproductive hormone levels are out of balance and may affect a female's overall health and physical appearance. Polycystic ovarian syndrome, also known as PCOS, leads to the growth of ovarian cysts, causing the female body to overproduce male hormones. While the exact cause of this condition is unknown, PCOS affects women's menstrual cycle, their ability to conceive and carry a baby to full term. When I was a teenager, I found out I have PCOS. Because of PCOS, I have had 5 miscarriages and struggled to keep my hormone levels balanced. According to womenshealth.gov, PCOS affects 1 in 10 women of childbearing age. Today I want to share with you a brief detail about PCOS and the many effects it has on women. Let's look at the main symptoms of PCOS and treatment options for those symptoms. Although a woman with PCOS is challenged with insulin resistance and abdominal weight gain, there are different ways to treat and minimize the effects on her body. A natural way to treat and prevent insulin-resistant level and abdominal weight gain is by eating a low-carb diet and adding healthy fats such as salmon, flax seeds, and walnuts instead of red meats and cheese. Abdominal weight gain goes hand in hand with insulin resistance and can be controlled similarly, but adding exercise as a daily routine. Metformin has been prescribed to treat diabetes and is used by doctors to treat the symptoms associated with PCOS. Metformin improves insulin regulation and contributes to weight loss. According to womenshealth.gov, after a few months of taking metformin, it may help to regulate menstrual cycle as well. Now that we have covered the main symptoms of PCOS and treatment options, let's take a look at other symptoms. PCOS can cause facial hair growth and acne, infertility, irregular hormone levels, and miscarriages in females with this condition. Doctors may prescribe medicines to treat infertility and regulate hormone levels. Hormonal birth control, Clomid, and progesterone pills are some of the medicines that may be prescribed. These treatment options may also help reduce the facial hair growth and acne. Having a hormone level that's well balanced will increase the chance of having a healthy pregnancy. According to Vineet Washington, greatest fear for an expecting mother, miscarriage, it is often not possible to prevent an aborted pregnancy. There are different ways to diagnose and identify the symptoms associated with PCOS. According to OBGYN.net, PCOS may be diagnosed through blood tests, ultrasound, physical, and/or pelvic exam. An ultrasound scan may show multiple benign cysts on the ovaries, and the blood tests will show a higher than normal level of androgen, also known as male hormones. According to womenshealth.gov, if the blood test results are showing a high level of male hormones, the doctors may run more tests. Once the doctor has ruled out other possibilities, PCOS is officially diagnosed. PCOS is not curable or preventable health condition, but its symptoms are treatable. According to Adam H. Bellin, Infertility in Practice 4th edition on Polycystic Ovarian Syndrome, the pelvic and the physical exam are to check to see if the ovaries are enlarged, and if there are any signs of male pattern hair growth or signs of other health condition. An enlarged ovary may cause abdominal cramps and bloating. There are over-the-counter pain medications that can be taken for the cramps. Unfortunately, bloated abdomen, and enlarged ovaries is a part of PCOS and will not go away. The physical features of having excessive hair growth and acne can be a struggle for women with PCOS to control. Waxing, shaving, exfoliating are ways to get rid of the excess hair growth and acne. In addition, there are support groups for women struggling with PCOS. A woman suffering from PCOS often struggle with anxiety and depression and need the support from other women with the same condition. According to soulsister.com, there is power in knowledge, so we are encouraged to pass it on. The empowerment of these groups oftentimes reduce stress levels associated with the disease. Sadly, my speech has only given you a brief description of the issues associated with polycystic ovarian syndrome and what it can do to a woman's body, as well as the different ways to treat the symptoms. To summarize, polycystic ovarian syndrome is a health condition that causes hormonal imbalance that leads to the ovarian cysts, but can be treated both medically and naturally. It is my wish that you will take the information I have given you and pass it on to your friends and relatives so that more people may be aware of PCOS and the many effects. What if you wake up tomorrow and you find out that you or your loved one has PCOS? Would you let it go untreated, or would you do everything possible to keep it under control? I have suffered from PCOS for over 20 years, and I refuse to be defeated by it. Will you?